Root canal treatment has to be done on such a tooth to save it from extraction. The pulp chamber is opened with help of high-speed drills, and decayed tooth structure is removed. Slow-speed drills are also used to shape and access the canals. Any remaining pulp is also removed. Special mechanically operated endodontic drills are used with progressive widths to clean, widen, and shape the canals. After the canals are cleaned and shaped, filling materials such as resin-based rasilon or rubbery material gutta percha in molten form filled in the canals. The same procedure is done in the other canals of the tooth. Some tooth may require additional structural support by way of retention posts. Special drills are used to make space for the retention post. The retention posts are cemented in place. The tooth is then filled with restorative dental material. The filling material is then light cured, which makes it a solid mass. Your dentist may provide your endodontically treated tooth with a crown to safeguard your tooth from fracture or damage. The tooth is prepared for the crown, and the crown then set. The healing at the apex begins and infection is healed.